Hello, my name is Allison Warner. I'm the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, Happy New Year. I'm glad to be back with you.
Happy New Year, Allison. It was nice to have a little bit of a break over Christmas and New Year's. I know many of the orthodontic offices took some time off at that during the holidays also.
Yep, exactly. So now with the holidays behind us and the new year, we're still in the middle of this pandemic. And if anything, we're at a crisis point. So positive cases are skyrocketing nationwide, which means the pandemic is starting to hit home for orthodontic practices like never before. What have you been hearing in recent days as orthodontic staff get back to work following the holidays?
Yes, the number of infections are increasing, and we're in the deep into the second wave, and some even say into the third wave of the infections
Yeah.
with this virus. And there's been a variant of the virus that has been identified and is again spreading rapidly that is even has a higher infectivity, almost double the infectivity of the original virus form. So more patients are coming in that could be positive, be in that pre-symptomatic stage a couple of days before they show symptoms, and the team could be exposed to it. One of the team members could, over the holidays during family gatherings, have gotten an exposure and tested positive. So we are seeing more risk and more team members that are infected. I recently even had an orthodontist call me that she had tested positive, and she goes, "Oh my gosh, what do we need to do?"
Right. Okay. So what has been your advice to orthodontists who have called you about how to handle notification in their practice?
Well, each situation is unique, and you need to understand the infectivity of the virus, which is about 48 hours before you show symptoms or would possibly test positive. You're going to be infectious, and that's one of the high infectivity periods. And then let's say the day you start showing symptoms, that's going to be day ground zero, if you will, day one of your infectivity. And then to about 4 to 5 days after you initially show symptoms, or if it was just you were asymptomatic and had a positive test. So that 7-day period is going to be the period of highest infectivity, your greatest risk of transmitting it to someone else. So I did receive a call during the holidays from an orthodontist that after Christmas, on the first Monday after Christmas, she had treated patients and wasn't feeling her best. She was having chills, felt a little bit achy, and she goes, her thoughts are, I don't know whether I have influenza or whether I have COVID. But she instructed the office manager, go ahead and close the office. And since it was the week of New Year's, they decided to close the office for the entire week and then reopen the next week. And so that was Monday. Tuesday, they didn't see patients, and her symptoms got progressively worse. So on Wednesday, she did go for a COVID test. The results came back on Friday, and she had tested positive. So now she knew it was not influenza, that she did have COVID, and she called me and said, okay, what are we supposed to do at this point? And my advice, my recommendations to her, and based on the state that she was in, and her practice is in a state that has a very high COVID-19 infectivity rate, was number one, she needed to notify patients that she had seen when she first started showing symptoms. So for that Monday, they needed to notify all of their patients, and she was unsure even of the scripting. And I said, well, what you need to do is either send them a text message, send them an email, or make a telephone call that you have notified them that one of your staff members has tested positive. There was a possible on the day that patient was seen in the practice, so they should be aware that that one team member is was tested positive,
Okay.
and emphasize in your message that your office is adhering to all CDC guidance to prevent disease transmission. So there should be no to minimal risk of
Mhm.
infectivity transmission in the office at this time. And she and I did a little sidetrack about, well, summarize what we should be doing. And number one is be sure that you're still taking temperatures on all team members as they arrive in the office and asking, do they keep symptoms, and having a log sheet of that.
Mhm.
If for some reason you have an outbreak in your office and 2, 3 more members test positive,
Mhm.
then the health department may ask to see those records.
Okay.
So you do need to be doing that. Is everyone wearing the proper PPE? A mask from the moment they come in the office in the morning until they leave at night, whether it's a level 1, 2, or 3, or an N95, depending
Mhm.
on the procedures that you're wearing. You're properly disinfecting, proper hand hygiene. And then the big important one is, if you don't have your mask on, are you 6 feet away from anyone else? And that happens during lunchtime.
Yeah.
And that was one of the questions I asked the orthodontist. Are your team members, are they able to 6 feet socially, physically distance during
Mhm.
lunchtime? And she said, you know, I leave the office at lunch. I live close so I can go home. I'm not really sure.
Yeah.
And we all tend to get lax. And I'm not
Mhm.
I'm not pointing a finger or anything. That's normal human behavior. We've been going through
Yeah.
this pandemic now for over 9 months.
Right.
And so we may let our guard down or let some symptoms. Now's the time to reinforce and refresh and start with 2021, making certain that you're doing all of the correct things. The next thing after notifying patients is
Mhm.
to have all employees, because they may have been exposed during lunchtime
Yeah.
or when they took their mask off for a hydration break, just to take a
Mhm.
sip of water. And were they 6 feet apart? How long was that hydration break? Was it more than 15 minutes? They need to fill out a CDC risk assessment.
Okay.
And it's a healthcare worker exposure. And we can put the link to that. It's on the CDC website,
Mhm.
available to everyone at no charge. It's about 4 pages, but it's easy to fill out. You're checking yes or no in most of the boxes, and it's asking about PPE, and were you exposed unmasked for more than 15 minutes? So the
Mhm.
pretty routine questions. And that gives you a documentation of the incident. And of course, then after completing that document and putting it in their COVID-19 file folder,
Mhm.
along with their employee logs, and they're keeping patient records,
Mhm.
obviously, of
Right.
temperatures and symptoms too, then it doesn't need to go to any agency. I
Okay.
think what every orthodontic office manager and doctor needs to remember is that all COVID-19 positive tests are reported to the health department.
Mhm.
And depending on the state, if the state sees those 2, 3, 4, or 5 infections and the same employer is listed, then the health department could come in and do an inspection or require the office to close, as they
Right.
would any employer where there's an
Right.
outbreak. And
Mhm.
we have 3 states now that OSHA has even written their own COVID-19 infection control program. And for instance, in Virginia, if there are more than 3 cases of positive diagnosis among employees in an office, that has to be reported to Virginia OSHA.
Ah.
Not just that it's automatically reported to the health department, but not
Yeah.
just Virginia OSHA. So,
Okay.
well, making it simple, they needed to notify patients for any patients seen on the day when the doctor had symptoms,
Mhm.
wasn't certain. And then all employees need to fill out the healthcare worker exposure risk assessment from CDC. And I would document the incident. That's going to be part of your respiratory protection plan. That you
Mhm.
just have a simple form that you fill out, that this is what the incident is. And obviously there could have been a risk of exposure, but minimal. And emphasize that in your patient message.
Mm.
And all offices by this point should have a way of notifying all of their patients that were seen. Because if
Mhm.
she had worked, let's say, I'm going to go back and change that scenario. Let's
Mhm.
say the office saw patients Monday through Thursday, took
Mhm.
Thursday off. Well, Thursday, the doctor started feeling bad.
Right.
and then went for the COVID test on Friday, then in that instance, the patients that were seen on Thursday and Wednesday would need to be notified to cover that 48 hours before symptoms or before a positive test. That
Okay.
window of infectivity that we talked about at the very beginning, that
Mhm.
almost, 2 days before, 4 to 5 days afterwards. And then we need to look at, when can you resume work? So we
Right.
had to count 10 days
Mhm.
from when she first had symptoms for the office to be able to reopen. And CDC has even put together 3 bullet points on that. So a healthcare worker who has moderate illness or no symptoms at all can return to work 10 days after symptoms first appeared, and all 3 conditions have to be met. At least 24 hours have passed since they don't have a fever without taking fever reducing medicines, such as
Mhm.
Tylenol. And then number 3 on here, their symptoms have improved. The symptoms
Okay.
don't have to be completely eliminated. They may still have a little bit of fatigue, or maybe
Mhm.
they don't have their sense of smell or cough back yet,
Right.
you know,
Yeah.
but those symptoms are improving. Then if all 3 of those conditions are met, they can return to work. If they
Okay.
were totally asymptomatic, but just had a positive test, then they
Mhm.
can return to work 10 days from the date that the test was taken, not the
Okay.
date that they received the results, because sometimes it'll take 2 or 3 days to
Right.
get test results back. So from
Mhm.
the date that the test was taken. Yeah.
Okay. Well, the reality is not, we're talking about the orthodontist here, but the reality is it's not just the orthodontists that are testing positive. And we've kind of addressed this before of, what happens when a staff member tests positive. Um, but everything you've talked about, that applies to them as well, every member of the orthodontic team
Yes.
staff or staff.
Yes, whether it's the front desk person or whether it's the orthodontic assistant, the same protocols apply. Now, I did receive over the holidays a unique situation.
Mm-hmm.
A doctor contacted me and said, "We have an orthodontic assistant who tested positive on December the 28th while they were on vacation."
Okay.
Now, they had closed the office 5 days before that on December the 23rd.
Mm-hmm.
So the employee had not been in the office for 5 full days before they went to test positive and went to get a test and tested positive. So we would assume in that situation that the infection was the result of a social or a family
Okay.
exposure with
Okay.
it, because she didn't, she was, even that 48 hours prior to the positive test, she was
Mm-hmm.
outside of the office. She was not seeing patients. So
Right.
there was not a risk of exposure for the other team members. There
Okay.
was not a risk of exposure for any patients with it. And then she would need to delay returning to work for 10 days from the date that her positive test and meet the 3 criteria that we've
Okay.
just talked about. And the doctor's question was, do we need to fill out this risk assessment? Do we
Mm.
need to
Right.
notify any patients? And I said, no, there isn't. This was not a work-related infection. So
Okay.
as a result, and it's a unique time. I mean, how often do we have our offices closed for 10
Right.
days even?
Yeah.
But a unique situation. And so this was not considered an exposure that patients needed to be notified or any of the other team members.
Okay.
But the
But
office
as you
does need, yeah, have that system for how are they going to notify their patients.
Right, but as you said, if this was a special case because the office had been closed, but if the employee did test positive, say later this week when they've been in the office all week, then they would have to notify. It would be
Notify patients
patients
seen
and
2 days before symptoms or positive test.
yeah,
And then, of course, then as soon as then obviously the employee is going to be quarantined
right.
in isolation out of the office. Yeah. So it is complex and everybody wants
Yeah.
to do the right thing. It's just confusing.
Mhm.
What do we need to do? And unfortunately, we don't have standardized forms that are available with the bullet points of do A, B, and C in this
Yeah.
order. The really best recommendation and the best guidance is the American Dental Association's hazard risk assessment
Mhm.
toolkit That's
Okay.
part of the return to work in there. And that's an excellent 5-page document that's available to the ADA members. And it gives you a very good flow chart or algorithm for evaluating, when does the employee quarantine, how long do they have to be out of the office, when can they return to the office?
Okay, great. Well, we want to end this on a positive note.
Yes.
There is some positive in the world right now. You actually got your first shot of your vaccination last week. Lucky you.
I
How did
did.
that go?
I was so excited. I received the first dose of the Pfizer vaccine on December the 29th. Now, I was put into that phase 1A group,
Hmm.
not because I'm a dental hygienist
Hmm.
and not because I'm a consultant, but
Yeah.
because I'm a caregiver for
Mm.
an aunt of mine that's in a nursing home.
Okay.
And I'm the essential care provider as they're defined.
Yeah.
So I actually received the vaccine along with the rest of the nursing home staff and when
Mm.
she received her vaccine that day.
Okay.
So I received the vaccine, no symptoms, no
Good.
discomfort, a little bit of soreness at the injection site for about
Yeah.
12 hours afterwards. And I immediately signed up for the V-Safe with my cell phone.
Hmm.
And so for the past 7 days, I've received my CDC wellness checks every day. I'm always happy when the smiley face comes up and I can click on that and say, how are you feeling today? Good. And so I received those for 1 week. That's one of the data keeping measures that CDC has put in.
Okay.
And then I'll go for my second dose on January the 19th.
Mm.
And about 2 weeks after that, I will have antibodies and be protected. Now, Allison, that doesn't mean that I can throw my mask into the air and say,
Right.
done with this now. I've got a shield around me protected.
Hmm.
CDC still maintains that as with this new vaccine, and we're gathering more data and information, that I continue to wear my mask and practice hand hygiene and social distancing.
Hmm.
And as we gather more information, and yeah, it's documented that you do have that shield of protection, then we may be able to do away with the mask.
Yeah.
And you want to keep your vaccination card because if you start doing international travel
Hmm.
or other circumstances, they may want to require that to see your vaccination card.
Yeah.
Because there's going to be certain employment restrictions for us as healthcare providers where we
Hmm.
can work. I just talked to someone yesterday that had applied to work at the Mayo Clinic that is close to
Okay.
me.
Hmm.
And they had to have documentation of their vaccination
Mm.
before they could go to work there,
Okay.
or they were going to have to be revaccinated.
Okay.
And interesting, this orthodontist that called me with her positive diagnosis over the
Mm.
holiday, she said, "Well, can I receive the vaccine after I've even had the infection, or do I need the vaccine?" And CDC's recommendation now is yes, you can receive the vaccine. You want to wait until you're feeling up to it.
Yeah.
Symptoms have subsided and everything. But yes, you should go ahead and get vaccinated even after you've had an infection because
Exactly.
those antibodies are temporary.
Yeah.
They're not going to last for a
Exactly.
long time. So
Hmm.
you want for sure
Yeah.
protection
Yeah.
that you can get from the COVID-19 vaccine.
Yeah. No, exactly. Well, great to be back with you again, Jackie. And we're in for another year of this, or
You
another
know,
year of the show, not the pandemic,
yeah,
hopefully.
I've been putting my email signature into my email address now as celebrating 2021. The vaccine is here. We're looking forward to a healthy and happy 2021. Yeah.
There you go. There you go. And apparently the sun is now coming in through my window, so I've got a glare.
Yeah.
And fun. All right. Well, thank you so much, Jackie. And we will be back next week with the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.
Thanks, Allison.
Thanks, Jackie.